Hi everyone and welcome to today's webinar. So my name is Mary Molden and I'll be your host today. A warm welcome to all of our attendees, healthcare professionals and organisations joining today, tuning in from Ireland and across the globe. It's a pleasure to have you all with us this afternoon for a really exciting discussion on the Masters in Positive Health Coaching with our programme directors for the course. I know they're all very busy, so it's really great that we're here today with them all together. So a few housekeeping rules. Your microphones will be muted throughout the webinar. If you have any questions throughout the webinar, pop them in the chat box here on the side and we'll be able to answer them in the final Q&A session at the end. Additionally, if you're looking back at the recording or if you missed part of the webinar or if you get knocked off or have to leave, we do have the whole webinar recorded and you'll be able to, if you have any additional questions, you can just let us know afterwards and we'll send them in the direction of the programme directors. So as we get started, I just want to share a little bit of information about the Centre of Positive Health Sciences and the Royal College of Surgeons in Ireland. So RCSI is currently the world #1 for good health and well-being, and we are also an Irish-based but globally impactful university. We are ranked in the top 2% of the World University Rankings for 2022, as well as being the Sunday Times University of the Year for student engagement. And these elements are very important to us. So RCSI is proud of its heritage and legacy of leaders in healthcare education for over 230 years. So we're committed to our vision of leading the world to better health and empowering healthcare professionals to elevate their careers and, most importantly, deliver better patient outcomes. Our mission is supported by the 3 institutional pillars, and we are passionate about delivering engaging learning experiences to healthcare professionals, leading transformational research and supporting societal wellbeing in Ireland and across the globe. So our programmes are suitable for all those across the healthcare sector, and additionally we take on teachers and people working in administration roles, leaders, managers, to just name a few who wish to develop their coaching leadership capabilities. We're currently offering programmes at postgraduate diploma level, masters, PhD and professional doctorate level. So if you are interested in any of these courses and want any information about them, please feel free to email us on any of our communications, or you can just drop it as an email to any of the emails we've currently sent you. And then additionally, we have our free courses, which include the Science of Health and Happiness, focusing on the general young people and the aging population. So if you're interested in some of those free courses, they're just on our course website. But if you can't find them or need help, just let us know and we'll be able to send them your way. So the Centre's programmes consist of an online content, on-site days and interactive webinars to offer a collaborative and supportive student experience, as well as an immersive development opportunities for both current and future leaders. So you'll see a few different types of our delivery approaches there, but this is just to name a few. So at RCSI, we make sure that the right support is there for you whenever you need it, and we want students to engage with the courses fully. So during your time with us, you'll have access to a number of different academic resources to support your learning, as well as having your programme directors, module leads and programme coordinators. You'll be welcomed to the programme during a 2-week online orientation where you'll get to use our programmes, get to kind of ask all those additional questions that you might have before you start the course, and just get ready before you even start the academic side of things. We also have an RCSI online library, so if you can't attend on site, you have access to that online library all the time during your course. We have reference guides, EndNote, academic writing supports, assessment feedbacks, recommended reading lists and assessment guides as well for you. And now just to give you a brief overview about the course. So the course is 2 years part-time. It's a blended learning approach. It is for EU applicants is 2,500, split over 2 years with a payment plan for each of those years. It's level 9, and then additionally you will have, it consists of 8 modules which are assessed using a continuous assessment approach with a research project in year 2. And then I suppose there are 2 on-site days for the modules 4, 5 and 6, which with the possibility of contact days in year 2, depending on your group arrangements with your year 2 supervisors. We're very lucky to have a team made up of education and industry experts, researchers and professionals who are available to you during your time in the course. So please do make use of them. When you join the centre, you will be invited to events and welcome to join our networking groups where we share resources, answer your questions, provide support after you leave. And then additionally, if you don't meet the requirements for the Masters, we do have a professional diploma in positive health where you can use this as a stepping stone onto the Masters. I will be hosting another programme information webinar for the diploma, so if you are interested in learning more about this course, please drop me an email after and we'll be able to kind of get you all the information and help you on your journey to getting where you want to go and reach your goals. So anyone progressing from the professional diploma who's currently on the professional diploma and wants to progress will be exempt from modules 1 and 3, I think it is. Correct me if I'm wrong. But we will have reduced fees for those people who are progressing, and then you can let us know anyway if you need any help with the application process. Application process for people moving from the professional diploma to the Masters is very simple. It's just the similar application process that you did for your professional diploma, except you'll have, like most of when you're applying for the Masters, most of the different elements will be pre-populated from the time that you started your application from the first course. But if you do need help with that, myself and Susanna are always around to give you a hand. So without further ado, that's just the basic information on it. I want to hand over to our 3 programme directors. I'm delighted to welcome our programme directors, Dr. Jolanta Burke, Dr. Padraig Dunn and Professor Christian van Newberg, to share a little bit about who they are and what they do and discuss the 3 main elements of the Master's programme, which includes positive psychology, lifestyle medicine, positive coaching psychology, and how the 3 elements come together and make the Masters in positive health coaching. So firstly, I'll just welcome Jolanta Burke. So Jolanta, if you would like to pop on your mic, and I'll just pop you up there now.
Thank you very much, Miriam, and welcome. No problem. Very, very warm welcome to everyone. Now, Miriam has done a fantastic job introducing you to the program outline, but it is really hard to tell you how amazing it is to be part of the program, even as one of the program directors, and to watch students grow and bond, because through the program, because of the content, because of how it is designed, we have incredible friendships coming out and people really growing personally and professionally. So I just wanted to mention that in addition to all of the knowledge that you're going to gain, there are also friends you are definitely going to gain through this program, and that is certain. Now, just very briefly, I'd like to talk a little bit about, just to introduce myself a little bit so that you'll know my background a little and understand why I'm doing some of the things that I'm doing in the program. And I'm also going to talk a little bit about positive psychology, what it is, and then a little bit about the modules that relate to positive psychology. So I have fallen in love with positive psychology about 20 years ago when I started reading it first. And I remember after studying psychology in the general psychology, I wasn't too keen on it because I felt it was very negative. But then when I've discovered positive psychology, this whole new world opened up that helped me grow as a person, but also grow professionally. And I have seen this happen to people over and over again. I have then decided to quit my job that I've had many years ago now, and went back to college and did my PhD in Trinity College Dublin, and I have lectured in positive psychology at the University of East London, Masters in Applied Positive Psychology and Coaching, the application of positive psychology in education at the university, at Maynooth University, and then applications of positive psychology in in workplace in Trinity College, Dublin, and that's specifically in this business school, in the School of Business in TCD. And my research relates to positive psychology and specifically the applications of it. What I try to delve into is discover some new ways to introduce well-being interventions. So combining lifestyle medicine and positive psychology, combining environmental, nature-based interventions and positive psychology, and then also exploring some of the mechanisms that would amplify the impact of interventions, because you'd be surprised how many of those interventions don't work if they are not introduced in the right way. And this is really what we're going to be discussing during the program as well. I'll tell you a little bit about it later. But before I do, let me just clarify what positive psychology is, because the program, the master's program that we've created, it has 3 components, and one of them is positive psychology. So it's a different perspective on health, different perspective on life. Positive psychology was created about 20 years ago to balance the imbalance that existed in research at the time. Just to give you as an example, for every article, academic article published about well-being about 20 years ago, there were 17 articles about depression or anxiety. So we understood people's well-being as the absence of mental health issues, but what well-being is as well, and very much so, is a topic of its own that actually delves into what makes our lives worth living, what makes our lives so good that we are flourishing psychologically, emotionally, socially. And this is really what positive psychologists do. We delve into this by studying people who are very good at this, who have gained skills, or maybe have just a natural talent to live their lives this way. And we try to learn from them. And from them, we've developed many interventions that we apply to the majority of us and help most people improve their well-being. And the applications of positive psychology are very intricate, in that when you apply positive psychology in education, it's not enough to just put 2 and 2 together and maybe take some of the interventions from positive psychology and bring them into schools, because research is showing us that this could actually lead to reduction in well-being. It has to be done in the right way. And that's why during the program, in the first part of it, we talk a lot about not only what is positive psychology, but what can we do to apply it. The same applies to workplace. When we are discussing about introducing some of the interventions in the workplace, not all of them work. Because some people might not even want to engage with them in the first place. So it's about introducing the positive psychology knowledge and intervention in a way that would be accessible to others. That's what matters. But the majority of the program content in the context of positive psychology, and this is the first 3 modules of the program, is really about health and what can we do in order to introduce positive psychology into the research and practice within healthcare, but most importantly to prepare people to later apply it as part of coaching. So if you decide to do this program, you will meet me in the first few modules, just discussing various aspects of positive psychology. And then I also look after a module on positive psychology coaching, where we delve deeper into how positive psychology can serve coaching. So what can we do in order to use positive psychology in our coaching practice to enrich it, to make it more meaningful for people, to improve their well-being to a higher level. We also are going to be talking about how coaching serves positive psychology, because some of the research that we've done here delves into the applications of positive psychology through coaching, amplifying eudaimonic well-being, which is a higher level well-being, this kind of contentment with life. And we're also going to discuss many of the models of coaching, and learn how to look at clients from the positive psychology coaching perspective, which is a very unique perspective where you notice things that you have never noticed before. And that's what our students are telling us after the program, that it is after this module that they've started looking and noticing in people things that they never thought existed, things like curiosity, passions, things like their experiences of various emotions that they never were able to pinpoint. So through this program, people have learned, our students have learned well-being literacy that will help their clients, but also help them in the future. So that's just a little introduction from me.
Thanks so much, Jolanta. That was really informative. I'm going to pass on to Pádraig now. Pádraig's going to speak a little bit about lifestyle medicine. Just a reminder to everyone, if you do have any questions throughout the webinar, please feel free to pop them in the chat box and we'll get to them at the very end. Work away, Pádraig. Thanks, Mel.
Great, thanks, Miriam. So good afternoon, everybody. You're very welcome today. Before I begin, I just want to say, and hopefully you've seen it through the screen, is the enthusiasm from Miriam here. And if you join this program, you will have excellent support structures from our supports, I should say, from our operations teams, led by Suzanne, who's also on the call. So really important that you've met these people, because in many ways, actually, they're more important than the program directors, I think, anyway. And without them, certainly the program wouldn't exist. So I just wanted to say that first. So thank you both for all your support with this, including today. So yeah, my name is Pádraig, and thanks very much, Jolanta, for that great introduction to positive psychology, which I always need to hear over and over again, because it's positive psychology is not my background, even though I very much enjoy it. And as you'll have seen from the layout of today's webinar, you know, we view this program and the center really as a three-legged stool, one of them being positive psychology in terms of one leg, one lifestyle medicine, and the other element coaching. So it's a very practical application of what we're talking about. So just very briefly, my background, I'm an immunologist, research scientist. I retrained as a psychotherapist. And I'm also a qualified lifestyle medicine professional. So I kind of combine these things. And why do I combine these very disparate kind of subjects? And the reality is that shock horror, your mind and brain is connected to your body, and your body is connected to your mind and brain. And both of them are connected to the environment around you, and not just the people around you, but the animals that are around you, and the leaves on trees around you, and the air that you breathe. So we're all one unified system on this planet, and we all interface in very different ways, inside and out. And it's important in terms of a health context that we understand that our minds and brains interface with the external reality, with the internal reality, with your big toe, with your beating heart, and with your partners at home. And I think modern medicine and science is about to get to grips with this. It's been very siloed over the last 150 years, probably. And we understand why, and it had to be, because these are very complex areas. But the reality is we don't live in silos. We are one integrated unit with our environments and with the people around us. So it's really important for us to understand that when we talk about positive psychology as one leg of this stool, that your psychology interfaces with your body. You're not just one giant head bubbling around. And likewise, maybe in medicine, you're not just one giant body with a tiny head. You've got one entire integrated system. And when we investigate that in terms of the science, what we look at are different interfaces, and you might look at the interface between your immune system, for example, and your mental health, or the bugs that live in your gut, and they're called psychobiotics, or your nervous system or your hormone system or things like that. But most importantly, we start from a base where the biggest problem is globally. And if we look at the biggest killers globally, it used to be infectious disease. It's not infectious disease anymore. I know we've just come through a big pandemic, but infectious disease is not the biggest killer anymore. The biggest killers these days are what are called non-communicable diseases. And every year, for at least the last 20 years, over 70 million people are dying annually from these diseases. And these diseases are often called the diseases of Western civilization, for example. usually down to poor lifestyle. So we're talking about obesity, metabolic syndrome, which is involved with type 2 diabetes, for example. We're talking about lung disease like chronic obstructive pulmonary disease. We're talking about heart disease in general, mental health conditions that can be seriously debilitating. And so we're talking about an awful lot of different conditions that are related to lifestyle. So how do we actually prevent these diseases from developing, and how do we help somebody who has one of these diseases maintain them and live a healthy lifestyle in spite of that disease context? So the first leg is positive psychology, and we move into the second leg, and the solution is lifestyle medicine. And lifestyle medicine, thankfully for us in terms of teaching it anyway, is broken into 6 discrete pillars. And they're obvious to all of us, but I'll go through them too anyway. So the first one is sleep. Second one is eating well. And when we talk about eating well in terms of lifestyle medicine, we're talking about eating non-processed whole foods and predominantly plants. Now, you don't have to be a vegan or vegetarian, but if you reduce the meat a little bit, turns out the science says that you might be a little bit healthier. So eating whole foods generally, if you can. And then we move into daily activity. It doesn't have to be joining a gym, but it has to involve physical activity of some kind. Then the next pillar of lifestyle medicine is stress management. And I don't need to tell you any more about stress management. It's really a pandemic in terms of a real impact on our societies right across the world. Then we move into the next pillar, which is avoiding risky substances. Now, 2 of those risky substances that are very big killers globally are tobacco consumption and alcohol consumption. Now, there are others out there, but we primarily focus on those. And then finally, we move into pillar number 6, which is cultivating positive relationships. And we can also extend out there into meaning and purpose. And you can also extend out into religion if you're religious, or spirituality if you want to call it that. And meaning and purpose. If you take meaning and purpose from a human being, then there's going to be a problem. So broadly speaking, that's where we are with lifestyle medicine. And then I started talking about interfaces, and I'm going to finish on interfaces because we're going to come up now to Christian, and he's going to talk about coaching. And for me, how do we deliver these wonderful sciences of positive psychology and lifestyle medicine? How do we combine them? And how can we put them into the hands of a healthcare professional who can translate it to support an individual live a healthier, better lifestyle? And that's really where we're trying to really be practical in this course. And that's where the rubber really hits the road, combining the sciences of positive psychology with lifestyle medicine to lead into the science of coaching and positive health coaching. So I'll stop there and pass you over to Christian.
Thanks so much, Porrick. Christian, if you just pop on your mic and I will hand over to you. So Christian's going to speak a little bit about himself and cover coaching, psychology, and how the 3 elements that we have spoken about before all come together and make up our masters. So take it away, Christian.
Thank you, Miriam, and thank you, colleagues, for introducing this amazing masters. We're really excited about it, and I think you've picked it up from my colleagues, all of us. This is the first year we've been running it. It's been a real joy to learn from and with the scholars who are currently on the program. So we're delighted. You know, before I met Porrick, eating well meant something completely different to me. So now it's yeah, I'm rethinking the whole eating well. But joking apart, you know, I think what's really powerful about this masters is that you do have 3 program directors that are bringing 3 really important fields together. So I'm just going to say something about myself, then a little bit about coaching psychology, and I'd like to give you some time for you to be thinking, how do these 3 things interact with one another? So please be thinking about that. We'd love to have questions about it as well, because you know, we're continuing to learn about this. So I was born in Beirut, Lebanon, and that's where I'm coming to you from today. So I'm delighted to be here, back in Beirut. I'm here for a visit. And, you know, it was quite challenging times when I was growing up here. There was a civil war going on. So I guess I've always been curious about how do people survive and thrive despite challenging circumstances? And really, as Jolanta said, that's the focus of positive psychology. Positive psychology goes towards, let's look at those people who are surviving and thriving despite challenging circumstances. So I guess that's been a lifelong curiosity for me, and that's brought me to coaching psychology. And what is coaching? Coaching is a conversational intervention that's designed to support people to learn, grow, and develop. I mean, to put it simply, and this is backed by research and evidence, is that coaching is a way to bring about desired behavioral change. And it's been shown that it can do that. And this can happen through conversation. But what is coaching really trying to do? It's trying to bring about this change in a way that's good for the person and in a way that supports that person to take personal responsibility for the change. So coaching psychology, I think, is a really important part of this master's. That's why we called it a master's in positive health coaching. It means that by the time you complete this master's, you will have all of the knowledge that we've been talking about, but you will also be able to practice as a coach. And not any coach, but a particular type of coach who has a broad background in lifestyle medicine and brings a positive psychology approach to their coaching practice. Now, what are you going to learn when you're on our program around coaching? Well, coaching has three key elements. One element is a set of conversational skills, and those are the skills of listening, asking questions, paraphrasing, summarizing. You'll learn those conversational skills. Of course, we all have those skills already, but it'll be looking specifically at how do we use those skills in coaching conversations. The other element is what coaches need to learn is conversational frameworks. I often say this, but coaching is a managed conversation, and it's actually the role of the coach to manage the conversational process, and that's why we learn some conversational frameworks, so that when you're coaching others, you're managing the conversation so that they get positive outcomes towards the end of that conversation. And the third element, my favorite element, but the one that I can't really describe, so this is going to be a little bit jumbled, and you're probably going to think, I don't know what Christian's talking about, but that's okay, which is the coaching way of being is really something about how we turn up as human beings, how we are. And it's a little bit confused for me because it's a combination of how you are genuinely as a human being, and we bring some elements of ways of being, that the kinds of ways of being that encourage others around us to be more trusting, to be more open, to be more hopeful, to be more optimistic. And to be honest, we don't actually teach that because I think it's very difficult to teach. We hope that we create the environment in which it's possible for you to learn more about the way of being that's going to be most conducive to the people that you serve. And it gives me an opportunity here just to appreciate and thank all of you who are either listening live. Thank you for being here live. It's wonderful to have you. And thank you to those who are watching the recording. All of us who are hosting this are genuinely grateful to you for your interest. This is something we're all passionate about. We want to see more positive health coaching throughout our health systems and within our society. So we're really grateful for your interest and engagement. And finally, what are the three components put together? What happens? And really, this is what our center, the Center for Positive Health Sciences, this is our big question. What potential is there? What might happen if we bring together the three legs of the stool that Parag talked about? That's our big question. And at the moment, one of the things that comes out is what we're calling positive health coaching. Now, positive health coaching is a form of coaching In fact, it's a form of positive psychology coaching, and Yolanta talked about that. It's a form of positive psychology coaching. And what is that? Well, positive psychology coaching is supporting people to grow and develop in a way that's good for their well-being. That's how it's slightly different from other forms of coaching. We have a dual focus. We have a focus on helping people to achieve change and a focus on their well-being as they embark on that process of change. So that's positive psychology coaching. What's different about positive health coaching? Well, it's actually quite different from other forms of coaching, because positive health coaching has an element of knowledge exchange as part of it, and that's very unusual in coaching. In most forms of coaching, the coach doesn't actually share information. It's a non-directive intervention. Positive health coaching is still non-directive, but we do share information that might be helpful for the client. And I'm going to wrap up shortly, but just to explain why we think this is so important. Most forms of coaching are non-directive and there's no sharing of information. But in this case, we're talking about people's lives, maybe literally, as Porrick was saying. And so if you as a coach and a health professional have information that's helpful for the client's well-being and health, it doesn't seem appropriate to us for us to withhold that information. So we've developed a new model of coaching. It is called positive health coaching, but it's based on a dialogic approach. So it's not directive. We're still not telling people what to do. It's not about that at all. It's about facilitating their learning and development. But during that process, we would share information based on lifestyle medicine, based on what we know from well-being from the field of positive psychology, so that we're providing that holistic support for individuals. So that's where positive health coaching comes in. What are the advantages of positive health coaching for our health systems? Well, one, we think how wonderful it is to have people like positive health coaches who can listen to and value people who are going through coaching towards better health and outcomes. But also positive health coaching and coaching in general is actually about encouraging people to take personal responsibility for their health and well-being. And because if we're able to support people to do that through coaching, we're actually empowering people to take more responsibility for their own health and well-being. So we're all really excited. The three program directors, we actually do research into this field. We've published some books and articles around this whole concept of positive health. But I just want to wrap up by saying, and I hope this doesn't put you off, but we're still learning as well. So every year we hope there'll be new content, new ideas, because we really want to be at the forefront of learning about positive health and positive health coaching. Thank you. Back to you, Miriam.
Thanks so much, Christian. Before we get into the Q&A session, I do want to mention our Women in Leadership Scholarship. After many requests, we've extended the deadline to the 30th of June. So currently this is our only scholarship that we are currently running. It's in collaboration with 30% Club Ireland. It is a fully funded scholarship for both the master's and the professional diploma courses that we are running. So all the information and application details will be in the email you'll be receiving at around 10 a.m. tomorrow morning with the recording as well. So if you do have any additional questions or need help with the application or anything like that, please let us know. We'd be more than happy to help. You don't need a course application to submit your application for the Women in Leadership Scholarship. And I suppose if there is any additional questions, just let us know. We're here to help. So I just wanted to mention that before we got on to the Q&A. But yeah, so we do have some questions coming in here. And I suppose we have additional questions for people that were registered for the event and couldn't come, but we'll be looking at the recording, so we're going to publish them. But I'm going to just go to the Q&A box first to get started with those, and then we'll just direct them to program directors. So As a qualified integrated nutrition and health coach, is the master's more suitable for me or is the diploma? Thanks. So does anyone want to take that? Or Yolanda?
I can go for it. I think first of all, it's up to you which one that you select, because both of them will give you additional knowledge. As you've seen here, the master's program goes way deeper than positive psychology or lifestyle medicine. So the diploma course goes into the lifestyle medicine and positive psychology, but in the master's program you also have coaching, so you know how to apply it. So both programs would be unique and go beyond nutrition into many other aspects of lifestyle medicine, but also positive psychology. And then in master's program you have this additional application, where you spend pretty much half a year on applying what you've just learned about both lifestyle medicine and positive psychology. So my thinking is, if I were you, I would possibly go for the application bit, but it's really up to you.
I think this kind of leads on to as well the progression from the professional diploma to the master's, and I suppose the differences between the two. Maybe Pork as well, you could maybe touch on a little bit about that and the differences between the progression from one to the next.
Yeah, sure. So I know we have individuals, Miriam, who are interested in transferring from the professional diploma into the master's, and we've had that successfully happen in the first year as well. So we're kind of limited by a certain percentage of recognition of prior learning. And I know you and Suzanne have more details on that. But the bottom line is that modules 1 and 3, they can be omitted if you transfer up into the master's, but module 2 can't be. So we've got a certain percentage of RPL that we have to abide by in terms of the rules. So that means that you will encounter, if you've done a certain level of lifestyle medicine in the professional diploma, you will encounter it again in the master's. Now, there is a difference. So it's not exactly the same content. It's more strictly adhering to the discrete pillars. It's more based on the American College of Lifestyle Medicine approach. And finally, it's tinged at the end with the introduction into coaching. How can you now, armed with this evidence-based information, how can you bring it into the coaching process? And that's when, you know, Christian and Yolanta and other colleagues take the baton and move it forward into coaching. So that's the difference, really. So it's not exactly the same. It's a different flavor, and it's more tooled towards coaching.
And I suppose additionally to that, we've had questions about on-site days and the coaching element that happens in the master's program. So Christian, I might get you to kind of expand on what happens on these on-site days and why they are so important and relevant. Because the professional diploma in positive health is completely online. And then there is modules 4, 5, and 6 that have 2 on-site days each. That students have to attend. So why do they have to attend those?
Thank you. That's a great question. And we've thought carefully about this. They are essential. They're a central part of the learning experience. And particularly, it's because we tend to focus on the practice of coaching during those days that we get together. Coaching, as I was kind of intimating, it's a very human interaction. And learning how to be a coach, I think it's a much more powerful experience if all of us are together in the room to learn those things. Now, in addition to that, our scholars are telling us how valuable those days are. So incredibly valuable. They're finding them a great way to connect with one another at that human level and to learn together. You know, the only way to learn coaching is actually through practice and then reflecting on that practice. So there's a lot of practice that happens on that day that's going to be a much better experience for the learner. So the reason they're mandatory is really driven by the learner experience. We really are committed to providing the best possible experience and considering all the different ways that we can deliver it. What we ended up with is thinking anything that can be delivered online to allow for as many people to participate as possible. We know many of our scholars are professionals who are already working. So we've put as much as we can online. And it's only those elements that we're thinking look, there's really no alternative to us coming. And by the way, it's beautiful to be in Dublin, where we are is wonderful. And, you know, to be very honest with all of you, those couple of days in every module that we get together, they're a real highlight for us as the members of the faculty. It's wonderful for us to see you in person. So for all those reasons, we're really committed to that. There is no alternative. If you feel you're not able to come to those on-site days, I would say it's probably not a good idea even to apply. But now bear in mind, the professional diploma is available completely online. So we still have options, but if you're going to do the master's, we think it's really important that you're there in person.
Thanks so much, Christian. So we have a few more questions coming out about specifically about the module deliverables and for the continuous assessment and the research project. So can you tell us a little bit about the assignments? Is there any exams and the research project? And I suppose you can all touch on this a little bit each yourselves.
Yeah, I can start, Miriam, if that's okay. So the assessments are mixed and broad right across the 2 years. So to give you an example of your first year, so for example, individuals are tasked with developing their own health plan. So it's really important to touch on this. As professionals, so we're on one side of the fence offering this course, we have to practice what we preach. We believe that's really important. So we engage in this science-based endeavor as well. It's also important, I think, if you're going to join these programs, that you do your best to look after your own health as well. You don't have to be perfect. I'm certainly not perfect, but you know, to engage that story, and you start that with developing your own health plan in a structured way, and then that health plan is examined in a way where you get positive feedback about it. So that's one way. Then there's the basic assessments, which would be, let's say, an essay. It could be a reflective essay on your health plan. It could also be an essay where you describe a review of a lifestyle medicine pillar. So let's say, for example, we have big research teams who publish a review about the most important aspects of sleep and what we have to pay attention to. You would have to write an essay on that and talk about how it links to lifestyle medicine, how it links to positive psychology, and maybe how it links to coaching. There are also group assessments, especially in module 2, where you're going to be a team, usually on average 4 to 5 people, and you'll be giving a research article. You'll have to dissect that research article as a team. You'll have to write an abstract on it, which summarizes it in a structured scientific way, and it's good to learn how to do that. And then the other thing you do is give a 10-minute presentation. So one person from the team gives the presentation live to us via this kind of process here. And then the whole team then must be present to answer questions on that. So that's the basic level of assessment. I don't know if Jolanta and Christian have anything to add there on that.
Yes, thank you very much, Porrick, and great question. In addition to what Porrick mentioned, because the second part of the program is very practical, we also have variety of assessments that would suit you if you wanted to, if you're into coaching or into discussions with clients, changing people's lives, because this is actually a recording of a conversation that you will have with a client. It's one of the assessments, or a little audio on how to, on your reflection on a coaching session with a client. So there is really a very broad range of assessments that suit people that are very much focused on learning new knowledge, but also learning skills and being assessed on those skills too.
And finally, Christian, do you have anything to add to that?
Yes, thank you, Miriam. I just wanted to add that, yes, there's different forms of assessment throughout. And I just wanted to highlight something about this master's program, which is there's, actually three things you'll take away from it. One is you're going to get a master's from one of the world's leading universities, a university that specializes in health and well-being. That's what we do. So that's the main component. It's a globally recognized master's, of course. But in addition to that, you're going to be getting an accreditation from the European Mentoring and Coaching Council. So it's really important for me to say at the outset, you're going to be getting the practical training to be a coach. So that's what Jolanta was highlighting, that some of the assessments are about your ability to be a coach. So there's that element as well. And uniquely, amongst many coach training programs, we run coaching supervision alongside the masters. So if you're a scholar on our masters, you'll also be supported to become a professional coach, and we support you through to becoming an accredited coach as well. So that's the second component. The third component, we marginally assess this, because the third component is learning about ourselves. There'll be, I hope, a lot of learning about yourself, your strengths, your well-being, your attitude to well-being. So there's a lot of learning going on. So by the time you get to the end of the masters, it almost splits into two parts. One of the assignments is about preparing your application to become an accredited coach. The other part of it is more towards you getting a better understanding of academic research processes, because this is a Master of Science, so it's very important for you to know about quantitative and qualitative research methodologies. So what I'm trying to say is we're assessing all of those things, but as scholars coming onto this program, just to be aware, this goes beyond maybe many traditional master's programs, which tend to focus on the academic side. We're looking at the academic side, we're looking at the practical applied side, and this is an invitation as a scholar to spend a couple of years learning about yourself. And, I don't say that flippantly. It's really, as Porrick was mentioning, we think it's a key part of the program, because for us, the well-being of health professionals, the well-being of coaches is critical if we want to provide the kind of support we want to provide for our patients, our clients, and all of those people that we serve.
Thanks, Christian. Just while you're there, Robert just wrote in and said, thanks for the introductions. I'm just wondering if the completion of the Masters means that you're accredited as a positive health coach. Also, is the completion of the Masters the equivalent of being a lifestyle medicine practitioner?
About the lifestyle medicine practitioner, I'm going to hand that back to Porrick. But just on the first part about will you be a positive health coach, you will be an accredited coach with the European Mentoring and Coaching Council, and you'll have a higher degree, a master's in positive health coaching. So it wouldn't be correct to say you're an accredited as a positive health coach, because at the moment there is no such accreditation, but you will be an accredited coach who is highly trained, I would say to the highest level that there is at the moment, as a positive health coach. And just about the lifestyle medicine, I'm going to hand back to Porrick.
Thanks so much, Christian.
Thanks, Christian. So was it Robert who asked that question, Miriam?
Yeah, so it's Robert, and the question was, is the completion of the Masters the equivalent of being a lifestyle medicine practitioner?
Right. So no, Robert, the answer is no there. So for example, you wouldn't be qualified as a positive psychologist out of this either, but there are huge elements of positive psychology in it, if that makes sense. So what you will get are the basics of lifestyle medicine and the pillars, but you won't be a registered lifestyle medicine professional. So I'll give you an example. The American College of Lifestyle Medicine has training courses that deliver lifestyle medicine professionals. So you can have one strand which is for qualified medical doctors, and another strand that's for other healthcare professionals. And if you do their kind of courses, yeah, you would be a qualified lifestyle medicine professional. And we don't offer that. We offer a unique take on coaching, as Christian said, that has a very important element, which is the positive health aspect, which is a blended form of the lifestyle medicine, positive psychology, bringing it into coaching and having that extra tinge that we believe any other coaching masters don't have. So no is the short answer to that.
Perfect. Thanks so much, Porrick. We have lots of questions to get through. So Denise has just wrote in and she said, my background is in, there's a whole list. So occupational therapy, health psychology, coaching psychology, basically there's lots there: eating disorders, specialist and sleep. She wants to know, do my skills fit your master's program, or do I need to be looking at PhD program?
I can take this.
Yeah, no bother. You want to go for it.
I mean, first of all, very impressive, Denise. It's wonderful to see your commitment to learning. Again, it all depends on what is that you would like to do, because it is very unique. So currently we have 2 coaches who are really experienced coaches, just like yourself, and many of them have actually a different background, but very experienced coaches, and they are getting a lot out of this program from the coaching perspective, because it is such a unique perspective. So if what you would like to do is trying to develop your practice, then master's program is the best for you. If, on the other hand, you would like to add value to the body of research out there, then a PhD would be good for you. Alternatively, you can do both, and the master's could be a stepping stone.
Absolutely. Like, we have lots of students that have done the professional diploma and have progressed on to doing research now as well, have taken time out of their professional career to do research because they were just so interested in this area and wanted to make an impact. So there is so many options, and I suppose for people coming onto these courses, they're like, what am I going to be after this? Everyone approaches this with their own goals, and I think it's really important to set your goals out before you even start applications, and come to these discussions. And if you haven't got enough after this and have additional questions, we're here all summer to answer your questions and see what is the right route and path for you. You might not know that yet, but having more of these discussions will help. And especially when you get on the program, people wait till the last month of their masters to be like, okay, what will I do now? When you get on the program, start asking the module leads, the industry experts, the guest speakers. Try and ask as much questions as you possibly can to be able to kind of find your own route and see what you want to do with the tools and resources that you've been provided on this course. And it will also affect the projects that you get involved in and how they can kind of be a help and an aid into the stepping stones into your career path that you want to take. So yeah, do get on to us if you want to take some time after this webinar and kind of write down a list of all your goals and how we could help you achieve them. That will be really, really beneficial, and we can get back to you then and see what we can do on our end. So thanks so much, Denise, for that question. Okay, so we have kind of covered a lot there. So the on-site commitment, is it in a block? So no, as before, I'm basically going to pop up the on-site day, the specific on-site days up on the website today, and I'll include it in the email tomorrow, so you'll be able to find that. The specific days, there's normally 2 days back to back for each of the modules 4, 5 and 6. And then additionally in year 2, some people prefer to meet their supervisor groups on site, so it just depends. Some of them are completely online as well for year 2, so you'll just have to figure that out with your supervisor. But for year 1, it's 4, 5 and 6. There's 2 specific days per each of those modules. Yeah, there's a lot of people worldwide trying to figure out logistics. Additionally, if you can't attend the on-site days, the professional diploma is completely online, so you can do that course as well.
Can I just mention something about Denise's query about living in Wales? We actually have one of our students lives in London, and she travels for the 2 days for the 3 modules without any issues. So there is already precedent for that, and also we have other people in another program traveling from France. So once you get yourself organized, I guess it's not such a big deal. And those days in Dublin are just really precious for the students.
Thanks so much, Jolanta. So I'm going to direct the next question to Park. So I don't have a medical background, but interested in positive health as working in Sláintecare healthcare community development work. Is this master's an appropriate course?
There's somebody working in Sláintecare Healthy Communities and Stroke HSE Healthy Ireland. I mean, this would be invaluable. Well, actually, let's go back to what you said, Miriam, again, about depending on what you want to use it for, right? So just knowing nothing about that, what's that person's name, Miriam?
Anonymous.
Anonymous, okay, anonymous. So if you just wanted to directly apply what we're talking about to your job in Sláinte Care Health Communities, the professional diploma is perfect for you because it's short, sweet, online, and can apply directly to what Sláinte Care Health Communities and Healthy Ireland are all about, as far as I'm concerned. If you want to bring the coaching element, you want to bring that into the workplace. If you want to use it for promotion, if you want to develop your own coaching practice, then the master's is probably more for you, but it depends on what your goals are. But you know, there are two really important areas in the country in terms of our healthcare system. Professional diploma really sounds like it would be a good fit.
Thanks so much, Pádraig. Additionally, like we have already recorded a professional diploma in positive health webinar, so I can include that link in tomorrow's email as well. But we're going to do another one of those live webinars with the program director, Trudy Mean. In July, we're just confirming dates. So if you want to be in person after reviewing that webinar and have additional questions, we can get, you can just register for that as well. There is a few more questions. Research project. Okay, we've gone into the research. Can we go into the research project in year 2 a little bit more? So a few people have asked for more details. Maybe it would be a good idea to see what current students are maybe doing. Maybe I'll give ideas. Maybe that would be helpful. Jolanta, do you want to start with that?
I mean, at the moment, I mean, first, one thing to note is that you are not asked to conduct any unique research.
Homework.
I'm so sorry. You did say to switch off the phone. So the first thing, very important thing to say is that you don't need to conduct any unique research. So please don't stress yourself out. And the reason for it is we don't want, this is within health, so we don't really want people to be bombarded with a lot of surveys from our students that whilst valuable for their research project might not be published out there. So what we are asking you to do is just understand what research is and write a proposal, and on that basis you will be awarded your master's degree. And for anybody who wishes to conduct the research that they have planned for, we will be able to discuss it with you and perhaps facilitate it in the future.
Thanks so much, Jolanta. And Pádraig and Christian, would you like to add anything that Jolanta said about the research? No, Christian, you're okay. Pádraig?
Yeah, just in terms of, so that proposal then, if anybody's interested, it's broken down into a standard research approach. So you would do a literature review. Let's say your area was, I don't know, helping people sleep with skin disease. You would go off and you'd have a look at the literature and what it says about that. You've got access in RCSI to all the prime global journals. So you would use that, you generate your literature review, that's your general introduction. You'd have the aims. You're writing this proposal as if you were going to act out the research, but you won't be. And then you look at materials and methods, and you will have learned about appropriate scientific materials and methods in the previous module. So you can pick which one is most appropriate. And then you put in the plan and how you're going to do the research. So the timeline and how you would do it. How many people would you need to do it? What are you going to look at? How are you going to look at it? And then finally, the stuff that everybody hates. What are the basic stats that you might need to use to kind of get meaningful results? And as Jolanta said, if you've got $1 million idea and your workplace really wants you to conduct this research, well, when you're finished the master's, come and talk to us and we'd be more than happy to have a chat. But it's a proposal. So as Jolanta says, don't stress out about, you know, having to conduct research and go off and get ethics and things like that. You won't have to.
And of course, we support you along the whole way, so you should never be stressed.
Absolutely.
So we do have some more questions coming in. Thank you so much for all these amazing questions. There is one more. Oh yeah, Denise just said, great to know people are travelling from London, Wales. Should it be easy? It should be easy in comparison. Oh, she's from Dublin, so accommodation is easy. Great, Denise, good to hear. And then just lots of thank yous. And I think, oh yes, Fred came in, and I'm just going to read this out. We answered it, but I'm going to read it out for everyone because it could be beneficial for someone listening back. For Christian, during the Masters, do you get coaching training towards EMCC certification, or do you get as well certified as a coach by them? So Christian replied and said, we work closely with them. By the time you complete the course, you will have completed the application to be a practitioner or senior practitioner with the EMCC. Completion of the course is recognised by them, so it will be almost automatic. So basically, we do help them along the way, and by the time you finish the course, you will be recognised by the EMCC. Any additional things you want to add to that, Christian, or is that all okay?
So just to say, we've worked very closely with the EMCC right from the outset. So they've looked at the program to make sure that it aligns with them. Basically, we've designed it so that you've met all of the requirements of the EMCC by the time you finish. And the EMCC has accredited our program so that it recognizes everything that's happened. All we need to do is send them an email to say this person has successfully completed the requirements. You need to demonstrate you've done the sufficient hours of practice, and then that's the bit I've said it's almost automatic. The EMCC would say yes, but then you as the scholar would need to register directly with the European Mentoring and Coaching Council. But everything is pretty much complete by the time you finish our masters. If I can just add one thing, I'm conscious of time.
Yeah,
is just that, you know, this is really a pioneering program. And so we're really excited with all of the questions and excitement about this. We really think positive health coaching is going to be a huge area of interest. We think it's going to make a big contribution. So we're inviting you to join us on that journey. And yes, Denise, I actually fly in as well. I live most of my time in England, so I fly in for those dates. So they are designed to make it possible for you to come in. They're intensive 2-day blocks, so you can fly in and then fly out after the intensive. But yeah, please spend an extra few days in beautiful Dublin as well.
Thanks so much, everyone, for those questions. Jan, did you want to add to that?
Just finally add to the lovely words that Christian has shared with you. Can I just say that one thing that I find fascinating is, and I know I've already said this before, but it really is an amazing experience, personal experience for students, and seeing people really sharing with us that, yeah, we've learned loads, it was brilliant, it was fantastic. But let me just tell you how amazing it was to connect with other people, like-minded people. Let me tell you how wonderful it was to grow personally and help my family become better versions of themselves. These are the things that our students are saying. So it is just, so if you decide to join us, be ready for an incredible personal growth experience as well as the professional growth.
Thanks so much, Jolanta. On that final note, because I am very conscious of time, I'm going to ask you all individually. So what excites you about the future of positive health? Jolanta, you're up already, so we may as well start with you.
To be honest, this is such a new field. It's a field that we, as a team, have been working so hard on helping conceptualize, and many people have helped us. Many students helped us do it by even asking the right questions. I think what excites me the most is the potential it has for making a huge difference to people's lives, for transforming their lives. It is that well-being literacy, but also positive health literacy that we are spreading that will hopefully help us shift our whole society into a more flourishing society that has less symptoms of mental health issues and much more happiness and well-being and just living your life to the full. That's what's really exciting.
And Park?
Yeah, thanks for that question, Miriam. That's an easy one. I think what excites me most about it is that it provides, and I know other aspects out there are doing this as well, but I think it really is looking at this element, and this element is a 360 view of health, not just, as I said, the siloed approach, and it includes your environment, as I said. And finally, what it does, most importantly, it puts the person back in the center of health. So whether you are a healthcare professional or in your education or whatever you're in, the person is the most important thing here. And for me, positive health puts that person firmly in the center. It's about promoting that individual to thrive in spite of life's slings and arrows. And that's what excites me most about it.
Thanks so much, Pádraig. And finally, Christian.
I'll echo Jolanta and Pádraig. Just those are the things that excite me. And the dimension I want to highlight is the focus on the person. I love the idea the person's in the center, but also on the professional. You know, that's one of the things that we really hope is a message that we're conveying, is that we really need to look after the carers as well. We need to think about the well-being of the professionals. So that's all integrated into this. And the idea of positive health coaching, our focus is on those people, you know, we currently call patients, or people who are wanting to enhance their well-being or health. But we also think positive health coaching has huge opportunities for health professionals themselves. So those are the things we're really excited about. Thank you for that question, Miriam.
Thanks so much, Christian. And thank you for all your amazing questions today as well. I know we have a few more, just everyone reiterating thank yous and stuff like that. So if you do have additional questions, after reviewing the recording or anything like that, drop us an email. We'd be more than happy to direct them to our amazing program directors that were able to join us here today. I never go over time on webinars, but this was just so enriching, and I hope it was of benefit to you all today. So thank you so much for taking the time out of your day and joining, or thank you for re-watching the recording. But for now, thank you so much for joining, and we'll see you in the next one.